Hi, good evening, everyone. We're going to get started in a little bit. We're just going to give people some more time to hop on before we start the presentation and discussion. We're going to give it about one more minute just to let folks trickle in, and then we'll go ahead and get started. All right, we're going to go ahead and get started, everyone. We'd like to welcome you to the Virginia Integrated HIV Prevention and Care Plan Town Hall. We really appreciate you all taking the time out of your evening to come and attend this town hall and participate in it. Uh, Next slide, please. All right, so first we'll just do some introductions for the integrated planning team. I'll go first. My name is Olivia Allison, and I am an HIV prevention specialist with the Virginia Department of Health. Ashley.
Hi, everyone. My name is Ashley Yoakum. I am the HIV Services Planner with the Virginia Department of Health and the Virginia Ryan White Part B program. I'll pass it off to Shahid.
Good evening, everyone. My name is Shahid Hafid. I'm a program evaluator in the Division of Disease Prevention, Hepatitis, and HIV Prevention.
Thank you, guys. Next slide, please. All right, so here is just kind of a brief overview of what we're going to be doing tonight. First, we're just going to go over some quick housekeeping rules for how the meeting will go. Then we'll give a brief explanation of what our current 2022 to 2026 integrated plan is. Then we'll kind of lay out our timeline for developing the upcoming 2027 to 2031 plan. And then after the presentation focus, we'll go into a guided discussion about HIV prevention and care services that will be used for the creation of the upcoming plan. And then we'll just have some closing comments and adjourn the meeting. Next slide, please. All right, so again, like I said, first we'll go do a presentation first. if you could keep any comments during that time to yourself, and then we will open it up for the guided discussion portion. If you'd like to speak, just please raise your hand. Depending on how your screen is, there is like a little raise hand function either at the top or bottom. And if you'd like to speak, just please use that to raise your hand, and one of us will call your name and you can unmute and give your comment. If you're dialing in through a phone, you can use the *5 function to raise your hand, and then you can use the *6 function to unmute and mute yourself back. And then before you give a comment, if you could just please state your name and your organization affiliation if you have one. We also just want to remind everyone to please stay muted throughout the discussion if you haven't been called on, just to kind of hold off any background noise so that we can make sure everyone can hear what we're saying. And as I said, please hold off on any comments you have until we reach that guided discussion portion. Then lastly, we just want to make everyone aware that this is a public meeting, which means that it is subject to the Freedom of Information Act, or you might have heard of this as FOIA. And this session is going to be recorded, and chat notes would be shared publicly. So with that in mind, just please don't share any personal or private health information that you wouldn't want to be in a public setting or public space. I'm gonna take a pause right now and ask Allison Green to come on and share a statement if she's on and available.
Hi, good night, everybody. As Olivia said, my name is Allison Green. I am the Senior Advisor to the Ryan White Part B program, currently acting in the role of the Acting Director. And I just wanted to share a brief statement issued by leadership that should govern the proceedings of this meeting tonight. And the statement goes, this call is focused on HIV Integrated Services Plan and is intended to collect input on this plan. We will not be handling questions pertaining to the Ryan White financial status during this call. Please feel free to email us directly with any questions on that topic. So leadership is just asking that if you have any questions directly related to the financial status of the Ryan White program, if you could email us directly, given that the topic for tonight's proceedings is the integrated planning, which I'm sure you know is very, very important to what we do in the Ryan White program. So we're just looking forward to having all the information and all the questions directed to that. So thank you so, so much.
Thank you, Allison, for giving that statement. Appreciate it. Let's go to the next slide, please. All right, so to start us off on the integrated plan overview, the integrated HIV prevention and care plan is a statewide plan focused on how Virginia is addressing and responding to the HIV epidemic. This plan came out of CDC and HRSA guidance back in June of 2021. And the plan is based off of the HIV National Strategic Plan, which prioritizes efforts to reduce disparities and improve HIV outcomes for certain priority populations. It's also based off of the Ending the HIV Epidemic Plan. You might have heard that as EHE, which aims to reduce HIV infections in the US by focusing resources in various jurisdictions around the country with the aim as well to end the HIV epidemic by 2030. So the EHE plan includes 4 main strategies, which is diagnose, treat, prevent, and respond. And so while Virginia doesn't receive EHE funding, we do incorporate these strategies within our goals and activities of the plan. So this is a joint plan with the Norfolk Ryan White Part B Transitional Grant Area. And then, so we collaborate with them on the creation of the plan, and they provide input on their area as well and put that into the plan. And then we also collaborate with the Virginia Community HIV Planning Group, known as CHPG, throughout the development of a plan. And so they get different sections of the plan throughout the development process and give their recommendations and feedback. And then throughout the 4 years of the current plan, they are provided updates on progress and really made integral to being a part of the plan as well. Next slide, please. So these are the 4 goals of the current integrated plan. And under each of these goals, there are various objectives and strategies and activities for Virginia to reduce HIV transmission, to improve the health of those living with HIV, and to achieve a coordinated response to the epidemic. And we are required to have at least the objectives for each of these goals. And so these are just kind of a high-level overview of what our plan is. Next slide.
All right, and so now we wanted to provide a really quick overview / update on where we are with some of our data indicators for the current integrated plan. And so these indicators show us how the activities that we've been working upon within the plan have really helped improve health outcomes, both for people who are affected by HIV as well as those with HIV. And so you'll see some color coding here. And what the colors mean is red means that maybe we're going in the wrong direction or we're going opposite of where we are hoping to go. Yellow means we have made some progress on our goals, but maybe we're just not where we need to be yet. And then green means that we are doing well and we have met the goal. And all of these indicators, the goal is to have these where we want them to be by December of 2026. So we still have, about 9-ish months to make additional progress from where we currently are. So the first one we have is that we want to reduce new HIV infections in Virginia by 25%. What we have seen is a 3% decrease from baseline. And what that means is we're seeing a slight increase in new HIV diagnoses from the initial baseline from 2017. And now, while that sounds like we're going in the wrong direction, there are some reasons for that. As many of you may know, we saw a large dip in new diagnoses in 2020 and even 2021 due to the COVID pandemic. And so in more recent years, we have seen numbers increase as more outreach is happening and more HIV testing is being conducted that may not have been conducted in 2020 and 2021. And we're seeing this about nationally, is that our numbers are just now coming back to about where we were pre-COVID. And again, as I said, we're seeing this nationally, not just here in Virginia. So the hope is with some more work, we'll still be able to make progress on this goal. Next, we wanted to look at timely linkage of care. So really looking at how soon someone can get linked to care after an HIV diagnosis. What we specifically look at is how many people are getting linked to care within 30 days of their HIV diagnoses. And we've made a lot of improvement on this goal. We're currently at 85%. Our original baseline for this was 71%. So we've made a lot of progress, even though we have not yet hit that 95%. And a lot of this is due to our Rapid Start program, where we aim to get people linked into care within 7 days of an HIV diagnosis, oftentimes being able to get linked to care same day. So we've seen a lot of increases among that. Our next indicator is looking at viral suppression among people with HIV. And this really looks at the viral load of HIV that someone has in their system. So we're looking to see less than 200 copies, meaning viral load suppression. And so our aim is to hit 80%. Right now, we're at about 62%, which is still an increase from our baseline. So we have made progress on this specific goal, but we still have a lot of progress to go with this one. And we do know that clients, people with HIV who are enrolled in our Ryan White Part B program do have higher viral load suppression rates. But this one is looking at all persons with HIV in Virginia. We also have some broken out by specific priority populations that we identified. So looking specifically at men who have sex with men or men who have sexual contact with men, Black MSM, Latino MSM, Black women, transgender women, people who inject drugs, as well as youth between the ages of 13 and 24. And for all of these populations, we have seen an increase in viral suppression and have made progress towards the 80% that we're looking at, even though we still have some ways to go with some of these populations. And so we also wanted to provide some progress on some of the activities or objectives that we had in the plan. So not just showing you some data, but also some qualitative information or updates. And we separated it out by goal. So for goal 1, looking at HIV prevention, we've been able to implement our NPEP Starter Pack pilot project at 32 sites across the one of our challenges is that our Charlie program that worked with those who were incarcerated to provide HIV testing, as well as working with people with HIV who had been recently released from incarceration. That program ended in 2025 due to funding reductions. We also had our HIV pharmacy testing program end in 2024. Looking at goal 2, which really focuses on people with HIV, one of our highlights is that our Part B program was able to transition to a new medication access model for our clients that accessed medications directly through our ADAP program or our medication access program. And so that allowed our clients to access medications through a local pharmacy versus having to go to a local health department or a local pickup site. And so that expanded their access. Our Virginia Ryan White Part B program was also successfully able to combine our ADAP and our Ryan White Part B formulary into an expanded ADAP formulary. One of our challenges has been that the Part B program reduced the number of agencies and services that were funded in 2025 due to funding reductions. Goal 3, which really looks at health disparities and health equity. Here, we were able to collaborate with the DC eligible metropolitan area to expand Part A emergency financial assistance services into Northern Virginia to ensure continued access to EFA services across the EMA. Again, one of our challenges is that our trauma-informed care program that really looked at providing training around providing trauma-informed services across our HIV service delivery system ended in 2024. And then lastly, looking at goal 4, which really looks at a coordinated response. In 2025, Virginia was awarded the electronic medical record or EMR contract through Oracle Health. And again, another challenge is that we had to eliminate state and federal funding to the Sentara Martha Jefferson Hospital for our hepatitis C cure and provider education project. So there's just a few updates or progress that we have seen in some of the activities from our current plan. And so now moving into the next plan that is currently in development, our integrated prevention and care services plan that will go from 2027 to 2031. So we are in the process of developing the next iteration of our Virginia Integrated HIV Services Plan. This plan will be the third integrated plan that Virginia has developed, and it will go from 2027 through 2031. So it's the next 5 years. This next plan will be based on HIV national goals and will be inclusive of ending the HIV epidemic plan. It will really be a continuation of our current plan and try and focus on activities and goals that we were not able to achieve by the end of 2026. We'll also be focusing on broad populations as well as geographical and regional disparities and equity. And this plan is due June 30th of 2026, so we have about 3-ish months left. This is just a really quick overview of the different components, just so you see what all goes into this plan. It is a large document. And so a lot has to go into this plan. We have our introduction, which really just provides an overview of the plan. Our community engagement, as well as the description of our jurisdictional planning process. This really goes into detail on how we put together this plan and how we engage the community, because we know at BDH we cannot put this plan together by ourselves. We have to engage with providers, with people with lived experience, including both people affected by HIV as well as those with HIV, as well as community stakeholders, our HIV prevention and care providers, our Ryan White Cross Park providers, other providers that we know engage with the communities that we engage with, housing, substance use disorder providers, mental health providers. All of that is a part of this community engagement process. That's part of why we're holding the town hall tonight, to get input from you all on what needs to be included in the plan. This section also talks about how we put together the plan. So what entities did we involve? Who did we engage with? As a part of the planning process. Our third section, which is our contributing data sets and assessments, this is really all of the data that we collect as a part of this planning process that informs additional sections further in the plan. So this looks at our epidemiological snapshot, which is really just an overview of what the HIV epidemic looks like here in Virginia, looking at both new HIV diagnoses, people with HIV trends, as well as looking at them by various demographics, so we can see, so that we can highlight where the epidemic is hitting hardest here in Virginia. It also includes an HIV prevention, care, and treatment resource inventory. So this looks at not only what services are available across the HIV service delivery system, including HIV prevention and care, but as well as what funding is available for HIV services, again, throughout the state. Lastly, there is a needs assessment component that really just looks at where there are service gaps and needs, again, across the HIV prevention and care service delivery system. And then all of that information is collected and summarized in what's called a situational analysis. So this really looks at where are their strengths, where are their gaps, really what does the epidemic look like here in Virginia? Because then that really helps inform the goals and objectives. So where we're seeing gaps, where maybe we're seeing some challenges here in Virginia across the service delivery system, that's what then goes into and informs our goals and objectives. How can we address maybe things that came out of our, our resource inventory, our community engagement and needs assessments, those gaps, and also what are some successes that we can build upon? What are things that are going well in Virginia that we can build upon as a part of the goals and objectives? So all of that really goes into the goals and objectives section, which really is the meat of the plan. This is the work plan that we then operate off of throughout the 5 years of the plan. This is the part that of what we're working towards as a part of this plan. Lastly, we have our monitoring and evaluation section of the plan. This is really talks about how we're going to oversee the plan. So once the plan is developed, it's not a plan that sits on the shelf, and gathers dust for 5 years. It is a living plan. So what that means is we're constantly having to look at the plan and possibly adjust the plan. It's hard sometimes to predict what's going to happen in 5 years. So we're constantly having to look at the plan and maybe make adjustments on what things are working well, maybe what things we didn't see coming. And so this section talks about how we're going to do that, how we're going to oversee and implement the plan, and also how we're going to evaluate the progress that we've made on the plan, and then share that information out to stakeholders, so that you all can also have a sense of where we're going with the plan, where we're making progress, and how your activities that you all do then help feed into the plan and achieving the goals and objectives. Okay. So just a quick overview of our timeline. As I said, the plan is due on June 30th of 2026. We've kind of broken out the steps for this plan into 4 stages. So the first one is foundational work. Really, this is where we're collecting a lot of that information that I talked about through community engagement sessions, looking at our data, compiling, the resources that we have available, and really looking at needs assessments that we've done more recently, to gather a lot of that information. And then we will shortly be moving into drafting the plan. So really putting together all those sections, deciding on goals and objectives. Then we'll move into reviewing and finalizing the plan, and lastly, submitting the plan to our federal partners in June. And so now I'm going to pass it off to Olivia to start our guided discussion.
So just before we head into this, just want to reiterate that the purpose of this time is to provide input on HIV prevention and care services in Virginia. And we'd really appreciate hearing your perspective on the questions that we pose. And again, we just asked if you could please raise your hand. And once Ashley and I call on you, we will, if you could please share after that. Again, just to reiterate, if you're dialing in through phone, you can use *5 to raise your hand, and you can use *6 to unmute and mute yourself. And then just want to make sure we have enough time. It is a pretty short town hall, so we're just going to ask to limit responses to no more than 3 minutes. We just really want to make sure that everyone has a chance to share. Yeah, and then as I said before, just please state your name and organization if you are affiliated with one. But now we are officially done talking at you guys, and we'd love to hear from you. So if you could please go into the next slide, Ashley. And we have our first question to pose, which is, who do we need to collaborate with in the development of this plan to ensure that needs are being met? Yes, Louise.
All right. So, who we need to collaborate with to develop the plan, with the community, having more outreach, speaking with more organizations to have the organizations to speak to their patients, their clients, just to have them be a little bit more involved with, collaborating and coming up with different ideas. Like, for example, while you guys were talking, I was writing down about this, Descovy, Biktarvy, the PEP and the PrEP pills. Since, we're talking about ending the epidemic of HIV, it's just trying to get the medication to be all over, Virginia, to be some type of complementary as well, like how we have condoms. If we really want to hit it hard, is to do it that way. But in order to do it, it's coming up with like a fundraiser, a gala. We did lose a lot of fundings, and I've seen it all throughout last year, hearing it from different folks at the same time. So it's just coming up with different ideas just to do fundraising to get these to go out there as well. But in order just to collaborate, we need to collaborate more with the community and find out what's going on at the same time, because even doing more research, I just found out right now while you guys were talking, East region of Hampton Roads, Norfolk, Portsmouth, and Central region like Richmond does have a higher rate. And it did go up a little bit more as well from what I was just collecting at the same time. But with that question, I would just say we got to reach out more with the community and get them more involved.
Yeah, thank you, Louise. And can I ask you a follow-up question if you don't mind? Thinking about like collaborating with people, Did you have any ideas to how best to do that with community partners, like more of these sorts of town halls, something in person, or like any, did you have any
So
suggestions?
I'm a client with Nexus program and also with a patient with um IDP clinic as well. So I've been doing outreach program for a couple of more than 10 years to be exact. And I would just say, in order to do that, it's just I've been speaking with Nexus coordinators like the director to come up with these ideas to do some fundraising, some more community outreach. So we've been actually doing more, how can I put it, like more events at the community center, like basically at like a community center in a way, but at the clinic. So we've been doing a little bit more outreach and I've been speaking to them as well with the clients and the patients, just so that they get on the same page. Hey, we need to do something more for the community and for HIV prevention at the same time. So I've been in this talks with the Nexus program, and it's just trying to figure out some plans moving on forward. But right now, everything's just still in the talks. This is my first time here. They wanted me to actually join to, get some discussion and get some inputs. But I've been speaking to Nexus, and we're trying to figure out some next steps as well.
Thank you for sharing, and we're really happy that you joined in today. Really appreciate your comments. Did anyone
You're
else
welcome.
have? Yeah, thank you, Louise. Let's see. Stacy.
So my question is, when I looked at the slide for the 2025 integrated plan progress on all 4 pillars that you all are working on, the challenges are the same across the board in that all the funding for every pillar has been cut based on the current climate, right? So I guess my question is, what would the next step be to ensure that that's not going to be the result of the next plan that is developed?
Yeah, that's a great question, Stacy. Thank you. Um, Allison, I didn't know if you wanted to share anything related to that, or that's also something that we can talk more about offline if needed. But I'm sorry,
Right.
Allison, go ahead.
Sure. Like I said, while we would want to answer the questions on funding, that is a funding question. And unfortunately, because of the statement that I gave earlier, we're unable to answer any of those funding questions. So that can be a question, and that will be a question that we collect and then get to respond offline, as Olivia said. So when it comes to the plan itself, the structure of the plan, what are some of the goals, objectives, and things like that, we can certainly answer. But when it comes to how we foresee the funding, making sure that all the different pillars, like you said, and how we ensure that all of that will be covered, that is something that we just need to continue discussions on. So we can't offer anything in response to that tonight, just because of that funding situation that you all know about.
I understand, and I understand it's a very difficult place. I think that our challenge then as an entire state is, developing a plan that has an implementation that is actually something that we can achieve, right? And so
For sure, for sure.
we can't achieve things without funds. And so, and I'm not talking specific to Ryan White B. We are fully aware that our prevention funds over the last year were also restructured and cut as well. So to me, this isn't about one specific funding source. This isn't about, it's just in general, it's very difficult to set up a plan with recognizing that the state as a whole has a challenge.
Agreed. Thank you so much.
I will say, I do think you are right, Stacey. I think that is going to be the challenge of putting this plan together. And I think that's something that we will be taking into account as we're putting activities and things into the plan. It may focus more on like community building and trying to identify additional community resources. And how can we still work towards those goals that we know we want to achieve and make progress? With, like, as you said, some of the challenges that we're having. So I think that is something that we are looking at as a part of the planning process.
Thank you for that, Ashley. You're right. You're right. We did we are in discussions to see how to increase the coordination across the state when it comes to services, just to shift from what we currently have in terms of just this reliance on money and funding to maybe just increasing how we work with our resources that we currently have, and maybe just tap into some of these resources that we're not using as efficiently. So thank you for reminding us of that, Ashley.
Just really quickly, it looks like we have another hand raised by David, and there's a comment in the chat about funding as well.
Yeah. David, go ahead, please. And thank you, Stacy. David, if you're speaking, I'm not sure. I can't hear anything. If yeah. Okay, anything, maybe if you need, maybe put your comment in the chat so we can hear, or so we can read what you have to say, or try toggling with settle. Oh, here we, okay.
Is that better? Okay, good.
Yes, thank you. Yep.
So along with the usual, of course, there's, along with the, I won't bother list, well, there's of course, providers, consumers, VACAC, the usual, well, I guess you call some of the usual suspects. But along with that, I would, if they're not normally or already part of it, I'd suggest maybe DMAS, because of their connection now with being a part of an insurer of some of the consumers of Ryan White or other HIV services. Prior, even though a lot of grantees were lost in the, temporarily at least, in the funding shuffle, perhaps including prior grantees, because some of them could be coming back into the fold at some point, or they could still be a valuable resource for information on the planning side of what's been working, what hasn't. So I wouldn't neglect prior grantees, even if they're not currently funded. And then perhaps, I don't know to what extent, I sometimes get the impression from a conversation I've had with a Part C recipient that there's not as much communication because they deal directly with the federal government, but perhaps making sure that the grantees that aren't necessarily going through VDH are also part of the conversation for their role. And those were just a couple thoughts I had about it. And on the money side, I don't know. I guess since money is certainly a factor, including someone, perhaps, or at least someone needs in communication, if not a regular part of it. Someone with, say, HRSA or the federal government, or someone in on the General Assembly budget side. I don't know if that's realistic, but maybe that's just the part you have to just sort of accept, is whatever's there is there. But I did notice that there is something in the budget for this year going forward for 2 years. It says something about a work group that's going to be looking at funding relating to Ryan White, and also DMAS, coordination with DMAS and Ryan White and other programs. So that might be something to keep in mind. It hasn't passed yet, or hasn't been signed yet, but I mean, that might be something coming down the pike. So there'd be that to keep in mind.
Yeah, thank you for those suggestions, David. I think that really speaks to the community aspect that we're looking at, and really starting to look outside of those traditionally like federally funded or state funded sources. I think that's something that we are looking at, especially as Ashley kind of talked about with our resource inventory. So really appreciate that perspective. Joseph, I see your hand next.
Yes, I just want to kind of express a concern that I had. This past September, Johns Hopkins University had released a study showing the impact of disruption to prevention and care services and the impact that it would have on new HIV rates. And all of their models indicated by 2030 that our HIV rates would actually increase. And it wasn't necessarily talking, about what happened in Virginia. It was talking about nationally. And I'm just concerned that if we have not hit, although this progress was made in those different areas, we weren't green in any of those. So realistically, looking for the next integrated plan, and models are indicating that we should expect an increase in HIV. Has that been factored in? Are there check-in points in the middle of this integrated plan that we can look at and say, hey, if we're seeing an increase, instead of waiting to into the end and just saying, oh, we missed the mark on that. What kind of conversations are happening so that we can do course correction or try to find ways to make up for this lack of funding?
Yeah, thank you, Joseph. And I think, Ashley, I might call on you for this as something. I know the integrated plan is a living document, and it is something that is regularly looked at and to see how things are going, just because so many things can change within the 5 years that the plan is created for. So, Ashley, I'm just going to bounce it over to you to see, because you have a little more experience with this current plan.
Sure. Definitely appreciate that comment and concern, Joseph. Yeah, so that's definitely something that we're looking at as a part of our monitoring and evaluation section. So really looking at one, making sure that we have goals and like health outcomes that are going to be achievable. And also, as you said, putting touch points in place. So we do look at the plan regularly, at least once a year, if not more often. But that's definitely something we'll be kind of including as a part of that monitoring and evaluation section, is how we're looking at the plan, how we're gonna look at whether we're achieving, making progress on the goals and for the plan, or whether there's something that maybe we need to tweak or look at as a part of the plan and make some adjustments. As Olivia said, a lot of times we don't often foresee things happening, but that's why we have a living document to go back and adjust and say, hey, things are impacting this plan that we didn't foresee. So how can we maybe change this activity to still try to make progress on it, but maybe not in the way we initially thought. So I hope that helps.
Yeah, and I think we're having different work groups for the different sections of the plan, and we are having a monitoring and evaluation work group, and I think that's definitely something that we will discuss in that and really put that at the forefront, because as I said, things just can change so much in that span of time. But to keep us moving forward, I will just quickly go to Mark Baker, I think, had his hand next.
Yeah, good evening, everyone. I think my question has been answered, because one of my questions was, how often do you look at the plan? Because I kept hearing we look at the plan regularly. Because the HIV landscape in Virginia is so precarious right now, I probably would suggest that you look at this plan more than just once a year. Even when you look at the second pillar, I think what's the second pillar, when you talk about the combining of the formularies from Part B and the ADAP formulary into one, that I foresee that even though Virginia has a robust HIV formulary, ADAP formulary, that may change for as far as it relates to cost containment, right? So if you're only looking at that once a year, and the ADAP advisory committee had made suggestions to reduce the number of the amount of medications that's covered on the formularies, that wouldn't do the community any good, because you're only looking at the plan once a year. And also my suggestion is collaboration is look at those Part A funded agencies within the Commonwealth and see how we can leverage additional support and resources through them to cover those service gaps in those areas that may have experienced some challenges in grant year 25. So collaborate with those Part A funded agencies, because they may have a little more resources and able to cover some of those service gaps.
Yeah, great suggestions. Thank you so much, Mark. Allison, really quick, I'm going to go to you, and then we will move on to the next question just to keep things on the right track.
Sure. I just wanted to answer just quickly on the same the about this, the same question that Mark just answered, or the comment that he just made about how often we look at the plan. Sorry, there's just so many things in my head right now. But I do want to tell you that while Ashley may have been saying that we look at it once per year, I guess in an official capacity, we can say we look at it once per year when we're getting ready to do our planning. But because we have to be making decisions, some of them in real time, some of them immediate and long term, we are almost addressing issues from the integrated plan probably on a weekly or sometimes a daily basis. And I'm not sure if the team mentioned to you as well, but one of the reasons that we are not, while it is a new integrated plan, the goal of this plan is to continue from where we left off in this current plan, right? And so for what that tries to do is anticipate some of, exactly as what Joseph was saying, some of those expected and anticipated increases in HIV because of these disruptions in services statewide, countrywide, and globally. We know that not because it's happening globally that it doesn't affect us here, because there's so much movement across the world, actually, right? And so when we're making these decisions, it's based on where did we not make these achievements that we set out to make, and how do we catch up? How do we bridge those gaps, as Mark said? How do we ensure that we move forward as best as we could? So we are, in fact, pretty conversant with it because at every point in time, all our decisions are based on the integrated plan and the various goals and objectives that we have set out to achieve in that. So I just wanted to make everybody aware of that and know that we are very closely aligned to it. Thank you, Ashley and Allison. Olivia, sorry.
Thank you. Thank you so much. I know my first,
You
your
know
first
why.
name, my last name. Yep. Same thing.
We
Yes.
share a name, sorry.
Yes. No, thank you so much for that clarification, Allison. And let's move on to the next question. All right. So what are some emerging needs that either you're seeing in the communities that either you might be a part of or that you serve or work with? Mark, yes.
One of what I've noticed in the northern region is a lack of bilingual mental health providers. And so that is a great need, and that, and maybe a great need statewide, but I definitely know in the northern region, there's really a big need for bilingual mental health providers.
Thank you. Especially for that northern perspective. That's interesting to hear. Luis, yes.
Just to piggyback off of what Mark said, that's like you only have Nova Salud, which is so far like one of the only organizations that I see that has a dominant of Hispanics, and there's practically, like he said, hardly any for mental health as well. The only thing is that emerging needs is that we need to, I just want to say, just re-educate the Virginia mental health facility as well with how they treat those with mental illnesses at the same time with those who are HIV positive and who aren't alcoholic, as don't drink alcohol, and they force you to go into these programs at the same time. So it's the lack of empathy within the industry of mental health aspect. I've seen that firsthand as well. Um, Another emerging needs is more of like housing situations going on at the same time. This, as we know that we are going through the housing crisis, everything just keeps going up. It's not getting lowered or anything. And those who are, HIV positive as well, under the stress can actually trigger, they could become detectable again. The HIV meds might not even work due to the amount of stress that they are having at the same time. So right now it's just like we need like stress reduction within the communities. So it's just basically just like I stated earlier, being proactive, getting the communities just to come out to these discussions, which is basically the most important thing to just keep pushing these public meetings out to the communities.
Thank you so much. Really, yeah, thank you for that perspective. Does anyone that hasn't spoken yet want to share at all? I really just want to make sure we're hearing from, you know, whoever's on tonight and want to make sure you're heard. Yes. Oh. Sorry, really quickly, I'll just read out the chat. Karen said emerging needs increase numbers of those living with HIV now getting additional chronic illnesses as they age. Okay, thank you for that. And then Dr. Cleo.
Yeah, thank you. Thank you for the opportunity to speak. Representing Norfolk TGA, I think one of the challenges that we have is data collection, especially on comorbid and co-occurring conditions, as we just mentioned, in terms of mental health, housing, justice, stigma and discrimination. I think that's important as far as getting a complex perspective of the epidemic and the shaping social demographic factors.
Yeah, thank you so much. And appreciate your collaboration. Let's go next to Raymond.
Good evening, one and all. Raymond Beveridge here in Becosin, Virginia. On the emerging needs, as I advocated last time on the first plan, is the needs for the aging population. And not only we were all focused on 77 million baby boomers, and then we got fooled by the 81 million Generation Next and the 84 million millennials that will all be flipping over the age of 60, which is for the Older Americans Act program level. But for people that are aging, it'll be 2050 before everything balances out. So, and again, as the plan evolves, plus I'll be sending it along to Allison about some material from the American Society on Aging. But the other one I have is we didn't do this last time, but it's become since the current plan was published, and the good gentleman in Northern Virginia brought up, Mark brought up the mental health providers. I think we should also look at BDH does that wonderful job of compiling the physician and medical shortages through all of Virginia by region. And I think maybe we ought to give that a cursory review. That's my suggestion on that, because I can think of, gee, if I'm in Pulaski and I can't get to a hematologist, I'm in big trouble. There isn't a hematologist available for blood analysis. So just my thoughts. Thank you.
Thank you so much, Raymond. Appreciate that. And then lastly, I'll go to David, and then we'll move to the next question.
All right, thanks. I would just, in this context, sort of echo what Mark Baker brought up about medication. And, medication is not new, but what's emerging about it is the emerging risk of losing some ground there on medication and core medical services in particular. And tied into that, with the, again, on the financial side, really, is that with the changes going on in insurance, tax credits, and so forth, is that the potential for an increase in demand for assistance with premiums and insurance. I think it used to be called HIMAP. I'm not sure if that's what's still called, but with I tend to be a bit of a skies falling person when it comes to the economy as a whole. But if with it wouldn't take too much of a shift in the economy for people that aren't really taking advantage of Ryan White right now very much to suddenly be at the door, especially with the Ryan White cutoff being much higher than other assistance programs. And I just think that may be an emerging issue to be aware of, is that potential for increased demand for traditional things, but at different levels than previously. Yeah.
Thank you so much, David. Let's go to the next question, but Audium, I do see your hand, so if you want to unmute.
Yeah, sorry, I wasn't really going to speak much. I was going to let you have it, but I just wanted to see, because I hear a lot with persons living with HIV, but with this being an integrated plan, it would benefit us as on the prevention side to hear about anything related to seeing about PrEP, needs of PrEP, maybe harm reduction, other things like that, because that's always also included in the plan. So if anyone had any feedback, I'd love for it to be shared as well if you have thoughts.
Let's see. I'll go to Reggie just because David, you just spoke, but I'll circle back to you as well. But Reggie or Reginald, I'm sorry, if you could come off mute.
Can you hear me?
Yes.
Good evening, everyone. I'd like to just elaborate or hit on a few things that was discussed in the very beginning of this conversation. A lot of it was centered around, funding. A lot of the, programs have been cut, and that doesn't have really anything to do with VDH pro se, but it has to do with the government. And a lot of times, we play the blame game. But coming up this April, a lot of us that's on this call who have a vested interest in this in March, a vested interest in this disease, they need to go to AIDS Watch and to see their senators, their representatives, and see them face to face and tell them what it is that we're encountering here, so that hopefully we could hit one or two of their ears, and they become compassionate enough to stand up and fight for us, so that we can get the care, the services, and all the things that we need. Thank you very kindly for allowing me to share.
Thank you so much, Reginald. And as Audium said, this next question kind of touches on some of those things, but just what can VDH do to reach persons with either risk factors for HIV? So I'm thinking about those not living with HIV. What can we do to reach them? And then also, we also want to touch on those living with HIV as well. So any thoughts on that? Anyone that hasn't spoken yet, or as I just put in the chat, you can also write anything in the chat as well, and we'll take note of that input there. Tiffany, yes, I see your hand.
Hello, everyone. Can everyone hear me and see me?
We can hear you, definitely. I don't think we can see
Okay.
you, but we can definitely hear you.
Okay. So basically, I just wanted to say that I think that when we start talking about resources, we probably should consider, like bigger resources. And one of the things that I've been waiting on is, like maybe some of the superstars that are like, involved with HIV and AIDS, to say, hey, we could do a fundraising maybe with singing or something to help different states. I think they're doing some of that in Florida. But yes, local resources are good too, but I think we need to think bigger, because we need to have some resources that may be a yearly fundraiser that will help our states, possibly with the plan that you all have, or, just brainstorming, but just trying to get some other resources besides just government, and depending on just government would be really helpful. And then local churches in our area, and maybe even, maybe having an annual fundraiser like we do with Dance Away Stigma when we were trying to keep our office open, that would help in our communities to have like a pot of money to maybe help with transportation, for example, or maybe help with cab vouchers or, things that might help them to be able to get to, resources that they might need because the hierarchy needs are, not being met as much as they should be. So if you can't get your hierarchy needs, a lot of times you won't take your medication. So that's one thing to look at. And then also utilizing some of the national resources that we have, like MMAC. I know a few people have been going to some of the things that they have. And then there's a resource called SAGE for people that are aging with HIV. And I think in the long-term plan, we need to make sure that we're, planning for people that are aging with HIV even more because we didn't think we'd be here and we are. So there's a lot of planning that's going to go into, like when we have eventually maybe have to go and get care when we're older. I don't know if the facilities will be ready for us because we have so many comorbidities that may be related to HIV medications, may be related to the virus, but they're here, So, and the other thing is I'm not local as much anymore because I work during the day, and just being understanding for people that don't work in the HIV field anymore that having things like you guys have been having at 6 o'clock is very helpful because there's a big population out there that we're not able to serve. And up until about maybe 2 years ago, I was having experiences with brain fog, and I went on the new medication that they have, and it helped a lot. But just, the simple fact of me aging, things would have happened probably without HIV, but with HIV on board. So I just wanted to make people aware of putting a plan with aging aspects of HIV to be in the plan as well.
Thank you so much for that perspective, Tiffany. Appreciate it. I'll just call on Louise last, and then we'll go to wrap up just because I want to be respectful of everyone's time tonight. So, Louise, I will hand it over to you.
Yes. So the other thing, just to piggyback off of everything, is also collaborating with GMHC, which is the Gay Men's Health Crisis from New York City, and also AmitaCare. AmitaCare is the HIV insurance company out in the city. Trying to get in contact with them and figure out like some type of plan just to integrate or extend their programs as well outside of the city, because I know there is a lot of jurisdictions when it comes down to that nature, but we are in a red alert. I'm just going to put it out there with everything that's going on with the lack of fundings, right now with what happened in Florida, I think it's the Ryan White Part A part of it, the shutting down of it. Pennsylvania, some nonprofit organizations talking just to see what they could do just to help out those who are affected by the lack of fundings. So also, even though we're a Virginia state, it's also getting in contact with our neighbors and trying to figure out, once again, it all comes down to fundings and just collaborate and come up with different ideas at the same time. But for us, it's definitely what can we do to reach more persons with risk of factors for HIV is having some more harm reduction programs out there as well, and for those who have early HIV, is having continue the HIV support system, like the counseling, the group therapy, stuff of that nature. Let's continue doing that, because that does still work, where everybody still could, interact with each other. From those who are from Gen X, millennials, boomers, everybody is all mixed, and we continue having these conversations. That's one thing. We are doing very well from what I've seen in different organizations that I've been to, from Boston, Massachusetts, to Connecticut, to Vermont, to Pennsylvania, so on and so forth. But being here in Virginia, you guys do have some great programs. But right now we are in red alert. It's about trying to figure out what can we do just to get more of the fundings for the stock shareholders, find out what else can we do. But definitely a huge gala, a huge party, something that could fundraise and do some more stuff from there. So I'm not going to take too much of the time, but that's just what I wanted to inform. I was writing so much down. It's my first meeting in years.
Thank you so much. We're happy that you attended this. So yeah, we're gonna, transition to wrap up. But if you guys have any other thoughts that pop up or comments, please reach out to either Ashley or myself or Shahid. Our contact information will be on the next slide. With any more input on the plan, we really would we invite feedback. So I'll turn it over to you, Ashley.
Thanks, Olivia. I do want to acknowledge a few comments that we got from the comments section. In looking at walk-in testing at our local health departments rather than appointment-only testing. Also preparing the need to prepare for the impact of Medicaid work requirements. And how those could potentially have an impact on the Ryan White program. And then also just being aware of the possibility that the federal government is not prioritizing new HIV prevention funding. And then, okay. So I just want to acknowledge a few of those that came in the chat. Did not mean to mute myself. As Olivia said, we have provided our contact information here. So if you have additional comments or questions for the integrated plan, please send them to any one of us. We do want to thank you all for joining us and providing your input and feedback. The information and feedback that you've provided tonight will be instrumental in the development of the upcoming 2027-2031 Integrated HIV Prevention and Services Plan. Once the integrated plan has been finalized, the finished product will be posted on the VDH website. We do value your presence and participation in partnering with us to serve people with HIV and those impacted by HIV in Virginia. I believe slides will be either sent out or posted as well on the VDH Town Hall. I think I saw that question somewhere in the chat. So we thank you and we hope everyone has a good night.
Thank you all so much.
Good night.
Thank you, everyone.
I'll go ahead and leave up the email in case people are trying to copy that down.